Hi, I'm Ushma Neal with the Journal of Clinical Investigation, and I thank you for joining us today for another of our conversations with giants in medicine. I'm thrilled to be in Boston today to interview the quintessential physician scientist, Dr. Barbara Kahn. Kahn of the Beth Israel Deaconess Medical Center and Harvard Medical School is best known for elucidating molecular mechanisms of type 2 diabetes, obesity, and insulin resistance, with a particular emphasis on the role of the adipocyte in regulating glucose metabolism. Thank you so much for joining me today, Barbara.
I'm really happy to be here. It's an honor.
So I'd love to hear a little bit more about your path through science, but let's start at the very beginning. Can you tell me a little bit about your parents and how you were brought up and where you were brought up?
Yes. So I grew up in a community called Fairway, Kansas. And actually, this was a community of only 1,800 people when I was born. This was land that had belonged to the American Indians and was actually given to the U.S. government. And so there was an Indian mission there, the Shawnee Indian Mission. And I think my parents had moved there because they had relatives in the general area, and also the school systems were really excellent. My parents were both born from immigrants. So my father's father came from Lithuania, and my mother's father came from Latvia. And my mother grew up in Michigan in a town of 200 people, Auburn, Michigan, where her father had the only store in town. And my father grew up in Chicago, and his father had a haberdashery. And my father was trying to save money when he was in high school and so on to go to college, but they lost all their money in the Depression. So my father never went to college, but nevertheless was very successful. My mother, after she had 3 children, went to college and then got a master's in social work when concurrent with having her 4th child. So as we were growing up, there was a major emphasis on education. They really thought that was the key to a successful future. There also was a big emphasis on community service and community leadership. And I think, we were all told that hard work and, perseverance and thinking big would lead us somewhere important in life. And my father used to always say to us, remember who you are. So I went to public school until the 7th grade. Well, actually, in the 7th grade, I changed school districts, but I did go to the public junior high school. And I was very interested in math and science. And I did well in math. And so one year, the math teacher asked me to write the exam. And the other students found out about this and, of course, were very irate. And the boys drew this picture of me as a ticker tape machine. Remember those machines with the tape coming out? And my tongue was the tape on the ticker. And I thought to myself, I need to get out of here. I mean, it is not possible for a girl to really excel in math and science in this school. So I met some family friends who were going to an all-girls school, private school in the Kansas City area. And so I went to this private girls' school for high school. And there were only 27 girls in my class. And it was wonderful. I mean, the teachers, the whole environment really encouraged students to be involved, not just in statistics, but as you've noted, I danced in the operettas and I sang in the glee club and I played field hockey and I, was president of the senior class and the student council, and it was really a wonderful opportunity. Now, there were 3 of us in my class who were really interested in math. So they actually had a teacher from the junior college come in 3 days a week and teach us algebra and calculus. And she in the beginning was pregnant, and then she sometimes would bring her baby with her to the class, but since there were only 3 students, it worked out quite well. So I felt that my high school experience was really very reinforcing in terms of leadership opportunities and scholastic opportunities.
So, yes, you were the valedictorian of your class and president of the student council, and as you noted, you played sports and you acted and sang. Did this presage an ability to be a multitasker?
That may be the case, yes. My mother also was a really outstanding multitasker. She had 4 children, but she worked as a social worker and then a psychiatric social worker. She met Fritz Perls and learned, Gestalt therapy and so on. So I had that kind of role model for multitasking also.
So speaking of your parents, is it true that Warhol painted your father's portrait?
That is true, yes. So my father, as I mentioned, was not able to go to college, but he was able to, at night, do an AA degree at the junior college, and one of the courses he took was typing. So he got a job as a typist and a secretary in a steel business. And I guess he did well, and they made him the truck dispatcher, and then a salesman. And then he worked his way up to be president of that company. And the company was sold to an international conglomerate. So my dad would go to New York once a month, and he met someone who had had their portrait done by Andy Warhol. And my father was determined to do the same. So he was quite persistent, and eventually he actually became a friend of Andy Warhol's. And my mother, my father, and I, one weekend, went to Studio 54 in New York with Andy Warhol. It was quite an experience, yes. This was many years ago. But Warhol did a great portrait of my dad, because in the background is this steel scaffolding. So it really reflects my dad, who had been in the steel business all those years and so on, and it's really quite outstanding. I will say something else about my dad, which is eventually that conglomerate sold all of the steel businesses, and they gave my dad the choice of either buying them or just letting it be liquidated. So everything my dad had built his whole life ended up being liquidated. But the way my dad adjusted was he decided to get a master's in business at the age of 60. And so he entered a program that mainly had mid-level executives, and he realized he didn't have the study habits. And the dean of the school said, I'm not going to let you drop out. So they had study groups and so on. My father got the master's in business, and then they asked him to teach in the program. So education was very important to my parents for their whole lives.
Okay, so let's get back to you.
Yeah.
Which is, my next question is that, so you're this outstanding high school student. What made you decide to go to Stanford originally to study anthropology?
Right. Well, growing up in Kansas was a great, very wholesome, wonderful experience. But my parents had taken us to New York and overseas, and I knew there was a lot more to the world. And I decided I needed to go to either the East or the West Coast for college. So 2 students who were several years ahead of me, who had sort of befriended me when I came to that girls' school, had gone to Radcliffe. And I had my sights on Radcliffe. And I went to interview at Radcliffe on a very dark, wintry day. And it was very intense. And the students seemed very intense and not particularly happy. And it made me think I should look beyond that. So then Stanford seemed like a great alternative in California. And I also was very attracted to sort of the progressive political atmosphere in California at the time. So, scholastically it seemed terrific, and then, overall the atmosphere seemed like the right thing for me at that time. Anthropology. Yeah, I was going to study either anthropology or astronomy. And the first astronomy course I took had probably too much physics for what I really wanted to do for the rest of my life. Anthropology, I thought, was fantastic, and I'd read a lot of work of Jane Goodall at the time and so on. But as time went on, I realized that I wanted to be able to interact more. I didn't have the notion of being a physician at that time, but just as my mother interacted with people and families as a social worker, I really wanted to be able to interact more, and that wasn't really part of anthropology as I understood it at the time.
So when did you pivot towards more pre-med?
Well, that's a really good question. So I went to Stanford in Italy. And the campus is in Fiesole, which is up the hill from Florence. And while I was there, we were studying art, and we were studying anthropology. We were studying the lithographers that lived in the Arno River Valley. And every day after our classes, we would take the bus down to Florence to sort of see the artwork or to visit the lithographers, for more of our research. And at the bus stop, there was a phlebotomy lab. And that kind of surprised me. And I actually had been diagnosed with type 1 diabetes as a teenager. And it was kind of frustrating in those days. There was no home blood glucose monitoring. There were no hemoglobin A1Cs. And it was very hard to know what your blood sugar was. And to get a blood sugar done, you had to call a physician's office. It wasn't an emergency. So it would be days before, an order went in. And then once you got the blood sugar drawn, you couldn't get the result. And you had to have a nurse or a doctor call for the result. And by the time you got it, you forgot what you'd been doing when you'd had the blood sugar drawn. But I walked into this phlebotomy lab in Florence, and I said, well, I'm a student visiting, and I'd like to have my blood sugar drawn. And they said, oh, that's fine. You're next in line. So I was able to have the blood sugar drawn. And then I said, how can I get the results? And they said, are you taking the bus up here again tomorrow? And I said, yes. And they said, we'll give you the result. And that, to me, was such an eye-opening experience. I felt like medical practice could be so different. It could be so much more patient-oriented. And I was really interested in how to help people live with chronic illnesses. And the idea that patients could actually have more control was what made me think I might go to medical school.
So then you got a master's degree at Berkeley before coming back to finish medical school at Stanford, correct?
Right. So I actually went to the Berkeley program because it was very experimental, and I had really outstanding basic science in the basic science departments at the University of California, Berkeley. So I was able to get a master's degree concurrent with my first 2 years of medical school.
At that point, or I read at one point in one of the interviews you've given before, that you had originally fixated on family medicine.
Yes, absolutely. So, I was very much in the mentality of sort of holistic and, I had no notion at all of doing research. And I thought family medicine was really the best way to help people cope with, medical problems and so on. It turned out my oldest brother, I have 3 brothers, also had decided to go into medicine, totally different motivation. And he also was interested in family medicine, and, we talked about that a lot. So, this was in the 70s in the San Francisco Bay Area. And, there was a lot of social change going on, and the women's movement was very important, I think, also in my idea that I could be a physician, and family medicine seemed like the calling.
So when did you start to pivot towards endocrinology?
Right. So I had decided I was going to avoid endocrinology because, diabetes was already too much of a part of my life, and I didn't want it to be my professional life as well. But I had a fabulous endocrinology rotation as a medical student at Stanford. And the attending was Dan Fetterman, who really was a Harvard man, but he took out several years to be chief of medicine at Stanford. And he was a phenomenal teacher. So on that rotation, any question that any trainee asked was a great question, and he used it to sort of enlighten all of us on a point related to endocrinology. And so after the rotation, I was talking to him as chief of medicine, and I was telling him that I wanted to go into family medicine. And he said, family medicine is very important, but I don't think you'll be happy in family medicine. I think you like to understand things at more depth. I think you'd be happier in internal medicine. So in fact, I did an internal medicine residency, but still thinking I would go into primary care. And at the end of the residency, there was a lot of pressure on me to do an endocrine fellowship. The faculty there wanted me to do that. And I thought, I can't just keep following in the footstep of, the script that's written for what you're supposed to do. I really needed to step out and figure out what I wanted to do. And so that was the very beginning of these fellowships called general medicine fellowships. And it appealed to me to do a general medicine fellowship because there was no job description. And that was exactly what I was looking for, something that was a blank slate that I could really figure out what I wanted to do. There was one stipulation for the general medicine fellowship. You needed to do some research. So, I had the perfect topic for research. I had read a couple papers out of the UK about home blood glucose monitoring. And it seemed like that would be really helpful for people with diabetes because at the time, all that was available was urine glucose monitoring. And of course, it wasn't very accurate and it was inconvenient. You had to have an eyedropper and put urine and water in a test tube and put a tablet in and it boiled, and at a certain number of minutes you had to read the color and the color kept changing. And of course, it also didn't reflect that moment what your blood sugar really was. So I was very attracted to the idea of home blood glucose monitoring. But there were two questions. Did it really work? I mean, there were no, blinded studies or, well, I guess you couldn't do a blinded study, but crossover studies to see, if it really worked. And would it have adverse psychological effects? So I designed a study. I got nurse educators and dietitians and other physicians and a statistician, and we did this study comparing blood and urine glucose monitoring in this sort of county hospital population in Sacramento. And what we found was that anybody who entered in this study improved their diabetes control. So I guess that's referred to as the study effect, and getting all the attention and so on helps people improve their control. But it was different from what they were reporting in the UK. And so I thought, I'd really like to go and compare our results with the investigators in the UK because, maybe it's a difference of their patient populations. They're not working in a US county hospital. Or maybe it's the difference in socialized medicine in the UK. Or maybe it's a difference in just, British attitudes, either toward one's own health care or toward the physician. So I also had a boyfriend in the UK doing a sabbatical, so it all seemed like perfect arrangement. And I wrote to these investigators, and they all invited me to visit. So I went and I presented our data, and we compared notes on all those things I was just mentioning. But what also happened was they arranged for me to have tours through their research institutes. And I realized there was a lot of exciting research going on in diabetes. So, at that time, all we had for type 2 diabetes really was insulin and sulfonylureas. And all we had for type 1 diabetes was insulin, and human recombinant insulin just really was becoming available. People were on beef, pork insulin and making antibodies and having erratic control and so on. And I realized diabetes did not have to be that depressing, that there actually was, great hope for what could be accomplished with research. So I came back from the UK and I decided I wanted to learn how to do research.
And is that what landed you at the NIH?
That's right. So I decided late in the application cycle. And at that time, I wasn't absolutely sure I would do an endocrine fellowship, but I wanted to work in an endocrine metabolism lab. So I applied to many institutions. And in the end, I decided to go to the NIH, yes.
So while you were at the NIH, your research delved into much more around molecular mechanisms rather than more clinical or patient-oriented research. And in fact, your first article was published in the JCI.
That's right. Absolutely, yes. Well, I had decided at that point that I really wanted to understand how insulin works. Because, if patients are responsible, for juggling their calorie intake, their carbohydrate intake, their insulin, their exercise, if we could understand better how insulin works, it might help people know which insulin to juggle at what time and how long to wait before, eating a meal or exercising and so on. And so I was looking for labs that really were digging into molecular mechanisms for how insulin worked. And Jesse Roth was head of the diabetes branch at the NIH at the time, and he was a wonderful guide. He directed me to various different labs there to interview and hear about the approaches. And I was really quite captivated by the lab of Les Salins at the time and Sam Cushman, which when Les then became director of NIDDK, Sam really was chief of that lab, and they were studying glucose transport. And none of the glucose transporters had been cloned at the time. So we studied glucose transport by something called cytoclasin B binding. So we were binding unknown proteins, and looking at their movement within the cell. And it was clear that insulin caused these glucose transporter proteins to move from intracellular vesicles to the cell surface. So I was really captivated by being able to understand that and how that got disrupted in insulin-resistant states and how changes in glucose transporters might contribute to the risk for diabetes or the severity of diabetes.
So all this time, were you thinking that you were going to go into clinical practice and private practice? Did you want to be an academic physician? Because soon after that fellowship at the NIH, you landed at Harvard as an instructor and then assistant professor and have now risen through the ranks towards being professor. When did you decide you were going to have a lab and be a physician scientist?
Right. Well, when I went into the lab at the NIH, I felt a bit like a fish out of water. And I felt like I had developed a certain amount of expertise in clinical medicine, and here I was starting all over again, having never done any laboratory research. And so I did that for a couple years, but then I decided I would do an endocrine fellowship there at the NIH. And of course, that was a really fascinating and exciting experience in that almost all the patients were on some study protocol. So one saw many, many cases of unusual diseases that one wouldn't see in a general endocrine clinic. But as I got my hands back into clinical medicine, then I realized I really wanted to be at a medical center. And I wanted to be involved in seeing patients, in teaching medical students, and in doing research.
So why did you pick Harvard?
Well, that was maybe somewhat serendipitous, but Sam Cushman, who was my mentor at the NIH, was invited by Jeff Flier, who had been at the NIH and just been in Boston a few years at Beth Israel Deaconess. He invited Sam to come and give a talk on glucose transport because Jeff had done a sabbatical in Harvey Lodish's lab where the first glucose transporter had been cloned. And so Sam mentioned that there was someone in his lab who was looking to come back to a medical center and so on. And that's how Jeff Flier and I got in touch. And then Jeff recruited me to come to Beth Israel Deaconess and Harvard.
Why have you stayed here this whole time?
Yeah, that also is an excellent question. I've had many great offers, opportunities to go elsewhere. And I think that it is just the incredibly vibrant atmosphere. And in terms of diabetes and metabolism research, there are just many outstanding groups approaching problems from various different standpoints. But I also have had the privilege to have some really great collaborations. So, I am active at the Broad Institute of MIT and Harvard. I'm actually the representative from Beth Israel to the Broad, and I'm an institute member there. And at the Broad, I met Alan Sagatilian, who is a chemical biologist who was at Harvard in the Department of Chemistry and Chemical Biology. He's now at the Salk. But that opened up brand new technological possibilities for the lab, which then led us to new hypotheses and new discoveries. So it's been an atmosphere, the greater Harvard, Boston atmosphere, where I've always felt like I'm, having new opportunities, new challenges. And the opportunities to move often meant building something starting with few people in the area. And it never seemed like quite the right time to step out and move into that gear. I will say, though, as chief of the Division of Endocrinology, Diabetes and Metabolism here, we did a lot of building, and we recruited both physician scientists, PhD scientists, and also expanded the clinical work. And we did have several program project grants, which were really synergistic and exciting.
Just even the laboratory career that you've had with GLUT4, RBP4, AMP kinase, all of the ways that this are regulating diabetes and obesity, and more recently, as you mentioned, this new class of lipids. What's next for the next 10 years of the Khan Lab with these tremendous trainees that you have?
Yes. So with the trainees, what's next is, making sure that they find their independent path and get terrific jobs. But in terms of the science in the lab, I've never felt more strongly that I would really love to see this latest area that we've been working on, these novel lipids, the branched fatty acid, hydroxy fatty acids. I'd really like to see those get into clinical practice. And these are natural products. They appear to be very safe. We have transgenic mice who've had, 15-fold elevated levels their whole lifetime. They're very healthy. They reproduce normally. They live a normal lifespan. We've given them to mice on a high-fat diet, to mice with type 1 diabetes. Our latest paper that just came out in JCI last week is about these lipids reducing the incidence of type 1 diabetes. And it would really, I think, set the field ahead if we could try these in human disease, either type 2 diabetes, type 1 diabetes, or other inflammatory diseases. We've also shown their efficacy in colitis. So the lipids themselves could be either nutraceuticals or a pharmacologic agent. But another way of approaching this is to understand really the pathways that make the lipids and break them down. And with Alan Sagatilian's lab, we've made progress in understanding the hydrolytic pathways to some extent, but we haven't found the biosynthetic enzymes. And I'm excited about doing that because I think there may be a way to regulate these in a tissue-specific manner if we could find those enzymes and pathways. So that really is a major focus going forward.
Are you as excited about time in the lab as you were at the beginning of your career?
Absolutely. Absolutely. In fact, I used to spend more time teaching and seeing patients and attending on the endocrine service and so on. And really, I've honed that down so that I can spend more time in the lab. And I think, the new technologies are phenomenal in terms of what laboratories are going to be able to do. And, the genomics revolution was terrific, and we've learned so much. And then, proteomics has progressed quite a bit, but metabolomics, I think, still has so much future ahead of it. And I really feel that understanding the metabolites, the metabolic pathways, the metabolic fluxes are going to be the key to treating metabolic disease in the future.
If you could not be a physician or a scientist, what other vocation do you think could have kept you engaged over a lifetime?
I've thought about that, and I really can't imagine being anything other than a physician scientist. And as you see, I can't give up the physician part even for the science. I will say this, if young people come to me and they say they're thinking of going to medical school, and I talk with them a lot about, is it that you want to take care of patients, or is it that you want to do research and have an impact on biomedical advances? If it's the latter, I say to them, I don't think medical school is the only route. And at this juncture, I think that being trained in engineering, bioengineering, or mathematics and biostatistics can have a major impact on the future of medicine. The Broad Institute, Eric Lander, Aviv Regev, they're mathematicians, and they have done so much in terms of originally genetics of human disease, but now dissecting the cell and the pathways and the molecules and so on. So I can only imagine being a physician scientist. But for those who want to have an impact on biomedicine, I think bioengineering and mathematics, statistics can also be incredibly powerful.
Well, thank you so much for joining me today, Barbara. It was a real pleasure hearing a little bit more about your life.
Thank you. It was an honor.